Hello, everyone, and welcome to our Zoom webinar, Understanding Alcohol-Associated Liver Disease and Metabolic Dysfunction-Associated Alcohol Liver Disease. My name is Marissa, and I'm the Engagement Coordinator at Global Liver Institute, which is the nonprofit dedicated to empowering patient advocates to collaborate with policymakers, clinicians, and industry to drive liver health field forward. This webinar is part of the Tackling Liver Cancer Disparities series held in collaboration with the Health Council of South Florida and the Southeast Florida Cancer Control Collaborative. On behalf of these organizations is Vicky, who I will pass it over to her to introduce herself and her organization.
Hi, everybody. My name is Vicky Perez. I'm the regional coordinator for the Southeast Cancer Control Collaborative, as well for the Health Council of South Florida. I'm a data and health specialist. So the Health Council of South Florida is a trusted regional organization, which is dedicated to improving health and wellness in both Miami-Dade and Monroe counties. For over 50 years, the Health Council has provided unbiased health data, strategic planning, and community services, while also fostering collaboration and advocating for equitable healthcare policies. The Southeast Florida Cancer Control Collaborative, also known as the SFCCC, is a voluntary network of healthcare providers, community organizations, and advocates working together to reduce the burden of cancer across Southeast Florida. It's supported administratively by the Health Council of South Florida, and it promotes education, advocacy, and research to improve access to cancer care in our region. Thank you once again.
Thank you, Vicky. Today, we are very excited to have Jenn Jones, the founder of Sober Liver, to present this important topic. In this session, we'll explore what ALD and MetALD is and how you can protect your liver. The goal of the session is to explore and help you understand a significant risk factor for liver cancer. Before we begin, I just have a couple of housekeeping items to go over. Please be aware that the session is recorded. We will do our best to identify any personal information. However, if this is a concern to you, please feel free to message me. Feel free to leave your camera on or off, whatever you're most comfortable with. And I will be monitoring the chat box the entire time. So if you have any questions or comments, feel free to put them in there. Or at the end of the presentation, there'll be an opportunity for you to unmute yourself and ask your questions directly then. Thank you so much, Jenn, for being here today. We are so honored to have you. And with that, I'll let you go ahead and start your presentation.
Wonderful. Okay, thank you, Marissa, and thank you, Vicky, for sponsoring this webinar series. And again, my name is Jenn Jones, and I'm the founder of Sober Livers. And I want to start today by saying, spoiler alert, I have not had liver cancer, but I have definitely had a lot of education about it, a lot of fear behind it, and a lot of living with that fear for the past 7 years. I was diagnosed in 2018 with alcohol-associated liver disease, which included decompensated cirrhosis and also alcohol-associated hepatitis. I still have my liver today. My MELD score dropped to a point where I did not qualify for transplant any longer. And so I still deal with having a huge risk of cancer every day. So that's why this topic is so near and dear to me. So with that said, I'm going to go ahead and share my screen, because what it has provided me is a lot of information and education about the warning signs, what to look for. So let me go ahead and put the slideshow on. Okay. All right. So once again, thank you guys for being here. This webinar, as mentioned, is part of the Global Liver Institute's Tackling Cancer and Disparities series. And I want to start saying something at the front. This talk is not about memorizing acronyms or debating our terminology. Living with cirrhosis means living with ongoing cancer vigilance, not just fear of liver failure. And this is why regular liver cancer screenings have become a part of my life and have become a part of anyone's life who is dealing with ALD and MetALD, and every scan carries weight. So it's also an important point that any cancer, not just liver cancer, can affect transplant eligibility or delay life-saving care. So with that said, I'd like to share a personal story. This is my dog, Orion. And he went with me through this thick and thin. He was at my bedside every day. My partner brought him at my bedside every day when I was in the hospital and also when I was in a physical rehabilitation clinic. And it was him that really got me through everything. In fact, after I was told after 6 months of sobriety that my liver had improved so much that I didn't no longer would qualify for a transplant, I traveled to the Mayo Clinic the following year in April to meet with the top gastroenterologist, hepatologist at the Mayo Clinic. His name is Dr. Shaw. And Orion, my service dog, came with me, and that was the first time I'd flown since 2013. You see, I have complex post-traumatic stress disorder, anxiety, and depression. These are a result of severe interpersonal violence that I went through. So having Orion as my service dog really helped me through every step of the process I went through in the early days. And so that's me, or that's not me, that's Dr. Shaw with Orion there. And then that same summer, unfortunately in February of 2019, my stepdad, he died of alcohol-associated cirrhosis. Now, I was raised by my father. My mom didn't raise me. I wasn't around her with her. She also had alcohol use disorder, or her husband very often. That just will show how much genetics, which we'll talk about in a second, really plays into this. But this was at his celebration of life, and I was feeling much healthier at this point. And in fact, so much healthier that I went back to school to get my 6 credits that I had left in communication studies at Colorado State University. And then I went on to get a certificate in health communication from the University of Colorado, Denver. And Orion was there by my side. Orion would sit right here in front of me. I have a day bed right here, and he would just sit there and watch me go through my homework and everything. And then this picture of him is very important to me because this was in July of 2022. And this was at Donor Dash before we started coming to Donor Dash as an exhibitor with sober livers. I was working the American Liver Foundation table, and I also walked the event, but I noticed he was getting a little sluggish. And so I started taking him to the vet, and eventually, unfortunately, on August 19th or August 15th, I heard the words that he had cancer. I had just had a biopsy of something on my chest as well. And on that same day, I found out I also had cancer. I had skin cancer. I had squamous cell cancer. And my grandfather, who died of melanoma, it's always been a genetic risk for me, so I've always been very, very worried and wary of getting skin cancer, and that skin cancer would end up being melanoma. Wasn't melanoma this time. I went in and I got what's called a Mohs procedure done, where they actually go into the skin and they pull it back and they pull it together, and it's right here on my chest. You can't even see it today. But when I went in to get this Mohs procedure done, my dog had died. I lost him August 19th. That was a Friday. The following week, I had this skin cancer procedure done. And when you know it, I went and sat down in the procedure room, and I was waiting for the doctor. And the song that was playing also played at my grandfather's funeral. So I just was a nervous wreck, as you can imagine. So I want to mention this, and the whole reason I'm sharing this story with you is because you never know what someone else is carrying when they receive certain health information. It could be another cancer diagnosis, it could be a sick family member, or a beloved animal who is a part of the family. So, as I mentioned, my melanoma risk came from sun exposure and genetics, not alcohol. But when you live with cirrhosis, any cancer becomes complicated. And it really changed the way I thought about preventable cancer risks, including alcohol-associated risks. And so this is why understanding risk, especially risks we can reduce, like alcohol, matters so deeply to me, and why today's conversation is not about blame, but it's about clarity and empowerment. So I know many of you have probably seen this slide before. This is our new nomenclature. If you have not seen this slide, I will walk you through it to a point here, but the point I really want to make here is that we now have an umbrella over steatotic liver disease, in which we have categorized different liver diseases under what is now called steatotic liver disease that used to be called fatty liver disease, because it all starts with a fatty liver. No matter what toxins you got sick from, whether this is from processed foods, alcohol, or both, the important thing to remember is it all starts with steatotic liver disease. Now, we came up with this new category called MetALD, and I'm not going to go into the specifics of how it's diagnosed because this is still under a lot of debate and talk, but I can tell you what we've known for a long time is that people with metabolic dysfunction who drink have a very higher risk of developing liver diseases and liver cancer. And so I just wanted to show this to you as a framework that we're using today. But the important thing to remember is that it's these drivers of the liver disease that's so important. And so when we look at progression, though, it's the same exact pathway. So I actually came to GLI last year at the end of the year and gave a talk about the fact that liver disease has the same progression. And so it's strange how we treat it as such with these different categories, but these categories that we're using are the drivers. So let me just walk you through the disease pathway. And so this works for MASLD, MASH, metabolic dysfunction, alcohol, or MetALD. So we start with steatotic liver disease, which is fat in the liver. It then forms inflammation, which is considered an F1, fibrosis 1 score. And then it goes to a fibrosis 2 score, a fibrosis 3 score. And if you still haven't done anything about your liver, you will eventually get cirrhosis. Now, the important thing to remember is that cancer can occur at any stage in this pathway. So now that we understand and we establish that the liver disease pathway is the same, the next question becomes what actually changes our cancer risks? So what changes the risks? It's not where someone is on their disease pathway. So what truly changes cancer risk is what is stressing the liver. The major drivers we're talking about are metabolic dysfunction, alcohol, and most importantly, as you'll see on this top step, when they occur together. So let's start with obesity. It's associated with roughly a 1.7 to 2 times higher risk of liver cancer. And with type 2 diabetes, this next step, independently, that increases liver cancer by about 2 times. So even without alcohol, metabolic dysfunction is placing the liver under chronic inflammatory stress. And so when you mix that with alcohol, alcohol doesn't just stress the liver, it directly injures it. So when you combine the metabolic dysfunction and alcohol together, the risks simply add to something that is quite synergistic. And what I mean by synergistic is I mean they multiply. They don't just stack. Obesity, diabetes, and alcohol together becomes the highest risk category for liver cancer. As you can see on this graph, you have a 5 times higher risk if you are considered in this MetALD category. So MetALD isn't a new disease. It's a higher risk situation. When the liver is undergoing multiple stressors, the cancer rises faster. So again, it's the same pathway, different drivers, and very different cancer risk. So remember, this is not about blame. It's about understanding where the risk is highest. And so we can do things like screening earlier and communicate more clearly with our providers, which is very important. So now that we've talked about alcohol as a driver for liver disease and cancer risk, I really want to pause and say something that may surprise some of you. Some of you may already know this, but alcohol is a group 1 carcinogen or carcinogen, however you pronounce it, however you like to pronounce it, potato, potato, but it's in the same category as tobacco and asbestos. Tobacco and asbestos, which we have known for years have caused cancer. So this classification reflects a strong evidence linking alcohol to cancer. So this is not about opinion, it's about evidence. And actually, low levels of alcohol still matter. They can actually increase your risk of getting cancer, especially breast cancer, with each additional drink that you have. That's also true with liver cancer. So there really is not, and I'm going to repeat this, there is no clearly established safe level of alcohol when it comes to cancer risk. There is no clearly established safe level of alcohol when it comes to cancer risk. It's a very important point to drive home, and I ask you to share that with other people. So why is the risk different? The same exposure does not affect everyone in the same way. Your cancer risk is going to depend on things like your health of your liver, if you have liver disease, metabolic factors, and really important genetics. So the same exposure can carry different consequences depending on the liver and the genetics it is acting on. Some people are genetically more vulnerable to alcohol-related injury, inflammation, cancer development, and this is one reason why a person can drink similar amounts and have very different outcomes. So why does this matter for people living with liver disease? Metabolic dysfunction, alcohol, or both adds carcinogen stress. So genetics and existing liver damage can amplify that risk further. Once again, that same drink can mean very different things depending on the liver that you're dealing with. So understanding this risk allows people to reduce exposure where possible, have more honest conversations with clinicians, and make decisions aligned with our health goals. So understanding cancer risk doesn't take away autonomy, it is really giving it back. Once we know our risks, we can actually act on them. And so I'm going to just pause here for a second and share another personal story for me. As I mentioned, I have scans done every 6 months, and those scans involve either I go back and forth with ultrasounds and MRIs. And funny fact is I was just getting MRIs before because I had iron overload in my liver. So we were doing MRIs every 6 months. We switched back when my iron level got better. And so we switched to doing these every other ones. So when you know it, the first ultrasound I'd had in years showed something. And I had to then get an MRI to confirm whether this something was cancerous or not. And I will be honest with you, I really freaked out because this was the first time in 6 years since, in my liver had showed anything like this. So I go to University of Colorado, is my transplant center and where all my doctors live. And all of the ologists that you can think of live, and I think I have just about all of them. And so when I got this information about the ultrasound, I called right away to get an MRI because that's what they suggested. And the place that I go to, their biggest facility, which is UC Health at Anschutz, they did not have any MRI appointments for months. So I got on the horn with them and I called around and kept on calling. And finally, I got to have my MRI up in Fort Collins, which is where I went to college as well. And so I traveled to get this MRI done because it was that important to me. I was that scared. I'm like, we need to nip this in the bud if this is cancer. But this is why education is power. I mean, I knew immediately that the quicker that we find out what's going on, the better my chances are for survival. So I went up to Fort Collins to have this MRI checked and to have my liver checked with an MRI. And my liver was showing, it was actually a shadow. It was only a shadow. So, I mean, I got myself a little worked up for nothing. However, I was being diligent and it could maybe have not been a shadow. So that's why when the next time, which was towards the end of last year, I went for my ultrasound and they saw something new, I did the same thing and the same thing happened. They didn't have any MRIs at Anschutz for months. So I asked them where else could I go. So this time they sent me up to, where did I go? To Greeley. Colorado, which is another area of Colorado. I'm going to know, like I told the MRI people that I am going to be able to rate all the MRIs in Colorado by the time I get done doing the MRIs that I'm doing when I'm traveling, because it's a different experience each time. However, this is just going back to, I did that on Christmas Day. I went and I had this scan done on Christmas Day because, once again, I was really, really nervous. And so that's why I think it's so important for people to understand, even for someone like me who's never had liver cancer, having that fear, sometimes fear is a good thing. So having some fear with the combination of education will really prompt you to try to get the results faster and to understand what you're going through. So understanding, as I mentioned, cancer risk doesn't take away autonomy, as I'm showing you here. It really does give it back. So now let's talk about something that's really important and often misunderstood. So every time I travel around, and I've been lucky enough to be traveling last year to go and do talks, go to different conferences and other things. And I've been on a lot of Ubers and a lot of Lyfts. And I always talk about sober livers whenever I am in an Uber or a Lyft, if the person can talk with me. And they always ask me the same question. Not always, I shouldn't say always, there's never an always, but many times I get asked the question, how much can I drink before I'll hurt my liver? So I always say it's a crapshoot, because we don't know our genetics, and there's so many other things that are involved. So why do some people drink for years and never get liver disease or cancer, and why others get sick so fast? The answer is biology, not mortality. Alcohol doesn't act on a blank slate. This is important to note. It acts on a liver that's shaped by all of these different factors, including genetics, metabolic factors, sex-based biology. For example, women experience higher blood alcohol levels, and that they have faster liver injury at lower doses. Why? Because we have about half of an enzyme in our stomachs that our male counterparts have to soak up that alcohol. So the alcohol that comes into our system as women goes more directly into our liver to cause damage than for men. So as you can see, that there's different factors that come into it as to why people will get liver disease more quickly and get cancer. And so, and of course, existing liver injury. So if you already have steatosis, fibrosis, or cirrhosis, your risks, of course, increase. So the same exposure carries a very different consequences depending on that liver that we're acting on. So this helps us to explain to some patients why HCC with lower alcohol exposure, and why stigma-based assumptions about how much somebody drank are both inaccurate and harmful. This is a risk about biology. It's not about personal failure. And this is so important because alcohol-associated liver disease and now MetALD are at very high scrutiny levels as to, a person's moral character, a person's able to control themselves. And those are not helpful. The things that are helpful is to understand and find out the why someone is drinking. And if they're drinking too much and if they're addicted, there's always a why. And the mental health factor is so important. As I mentioned, I have complex PTSD. The majority of people who have alcohol-associated liver disease and MetALD carry at least one mental health issues that they're dealing with on a daily basis. So we need to just stop, take a break, and really look at ourselves as a community and love one another. And so, as I mentioned before about breast cancer, it actually disrupts multiple cancer pathways throughout the body. So alcohol and its breakdown products can cause DNA damage, can increase inflammation, interfere with the body's ability to repair cells. And for some people with liver disease and metabolic dysfunction, The same pathways are often already under strain, which can magnify the risk. So understanding how alcohol contributes to cancer helps us replace fear with informed decision making. Knowledge is power, from fear to understanding. So I know a lot of people are out there, they don't like the C word, right? You hear the word cancer and we all get scared. I think, well, I can't speak for you. I get scared many times. And when alcohol is involved, that fear is often layered with shame. I had so much shame when I was in the hospital in 2018, almost losing my life to liver failure, that I didn't let my partner call my parents. And I could have died that day. I always say my sobriety date could have been my death date. And I just look back on that, and I actually formed guilt around it too, a lot of guilt around it. So, then you bring in the cancer element of it. And people who have liver cancer that is due to alcohol, they also are carrying a lot of shame, and we really need to change that conversation, because risks is actually biological. Once again, as I mentioned, it's shaped by genetics, metabolic health, sex-based, and liver disease. It's not by willpower, okay? And this is so important. And this is how we can reduce the stigma. We don't want to minimize the risk by explaining it. So another reason this matters is that the cancer landscape, especially for liver cancer, is changing, which is some exciting stuff. So what's important is that liver cancer treatment has changed dramatically in recent years. As somebody who has to get scanned every 6 months for liver cancer, I try to stay up with the trends and look at all the new work that's being done. And it's really amazing, some things that are being done right now in immunotherapy, combination approaches. They have improved liver-directed treatments, and there's emerging technologies offering new options and new hope. In fact, when I was at the ASLD's liver meeting last year, I got to see these new technologies in action. Specifically, I got to see something called histotripsy. And histotripsy uses sound waves to break up tumors. It was truly remarkable to watch this. And the most interesting part about this, to me at least, was after the tumors break up, they get absorbed in the bloodstream, which actually help protect the liver, the body, from future tumors. I thought that was pretty amazing. So I want to kind of ground this for a second too, because whether you have alcohol-associated liver disease, whether you have MetALD, or you're wondering about this MetALD category, I will tell you that many times, most of the symptoms of this disease are going to be very similar. And the problem with this disease is there's not many symptoms until it becomes too late. And so, like for me, I had my first symptoms were my feet felt like they were wearing socks. And that was my peripheral neuropathy. And I had no idea what peripheral neuropathy was at the time. In fact, I was in my late 30s when this happened. I was not diagnosed with liver disease until I was 46, or cirrhosis, I should say. I was diagnosed with a fatty liver, and that was in 2013 when I was going through a lot of problems being stalked by an abusive boyfriend. And when I was diagnosed, they sent me for mental health treatment, but they did not get me in touch with a hepatologist, a gastroenterologist, or even a PCP that could talk to me and educate me about liver health and also about the cancer risks. So I just want to stress, and if anyone has any questions in regards to symptoms of liver disease, including MetALD and ALD, I am happy to answer those questions after we get done here today. And so before we close, I want to share a little bit about my baby, which is our Sober Livers Hope program. And Sober Livers, the HOPE program is healing ourselves with peers in education. We have a wonderful community, and I see a couple of our advisors are on the call today. So thank you guys for showing up to support me. But it has been an amazing experience. We launched our HOPE meetings in June of 2024. So we're going on year 2 now. We have added meetings. We now have online meetings that include meeting once a month for open discussion. We have education sessions that are led by our Whole Health Advisory Council members and other experts that we bring in. We had a writing workshop this last year, which was excellent. So a little different twist on some of the education that we provide. We also had a social worker counselor come in that she's actually my counselor for my disability. And she came in and she talked to our folks too about disability. So we try to bring to the table what it is that our community wants to hear about. And then we just launched Zero Proof Fridays, which was a carryover from a very successful meeting that our project coordinator, Lindsay Moore, runs. And we had it was festive, but not fermented during the holiday seasons. And now it's called Zero Proof Fridays. So if you haven't joined that and you have AUD or alcohol associated liver disease or a transplant, and you're curious about joining that meeting or our other meetings or sessions, please go to either the QR code here or soberlivers.org. And we are continuing to expand our meetings. We are going to also have a young adults hope group for people that are under 40. That'll be led by Lindsay again, and also Nicole, who I see here is on this call. So I think that this is going to be so important because people who are under 40 are dealing with a lot of other issues than just their liver. This is the time in their life where they're developing families, their professional life, all kinds of things that can really go south if they get either liver disease from alcohol or MetALD or cancer or all of the above. So I'm curious if anybody has questions, but before I go into asking about any questions, I definitely wanted to make sure that I thank the Global Liver Institute and also their incredible sponsors for hosting a webinar like this one. So conversations about cancer, alcohol, and liver disease are not easy, but they are absolutely necessary. So once again, I don't have cancer, but I share this personally because I am so vigilant about my scans, and I encourage everyone to be the same. But just as important, stay informed and stay educated because, as I mentioned, things are changing quickly in this space, and it's a good thing. And we're here for you. So once again, if you'd like to join us, please visit soberlivers.org. And I just want to thank everybody so much for being here and for the work that each of you do. And I hope you have a wonderful rest of your week. But I would like to open this up to questions, and let me close this up now. I'll bring up everybody here. So I wanted to see if anybody has any questions for me in regards to maybe symptoms of this disease, because I really didn't go into that. Maybe questions about why that MetALD has not really taken off yet as a disease category, and things like that. So go ahead and I want to see if there's any questions from the audience, and I can answer some of my own questions.
Hey, Jen, this is Mark Kern.
Hey, Mark.
Hey, quick question for you.
Yeah.
A great presentation. Very succinct. I really liked it. So recently, the Trump administration has put out guidance on alcohol consumption and taken away the metrics. So I think it was 1 drink for a female, 2 drinks for a male on like a daily basis, something like that. And then they took off all quantifications of alcohol amounts that could be harmful.
Yeah,
they actually made an endorsement that it could actually socially be used as a lubricant. So in other words, there's an endorsement, a hidden endorsement. And my question is, and I know this is fairly recent, news is what are groups like Sober Livers and the different liver foundations, et cetera, doing to address that?
Well, thank you for your question, Mark. And it's a question that has definitely been coming up in this field. And so what I want to provide for everybody is this is a position statement that was put out from AASLD that is exactly in regards to this position statement that states that we really need to follow the science and the evidence as it is said, especially when it relates around liver cancer and the levels of drinking. And as I mentioned earlier, there is no safe levels of drinking. We as Sober Livers and Fatty Liver Foundation are also concerned about this guidance. And so we want to let everybody know that we follow the science, and so does AASLD. So I encourage everybody to read their statement because it was very well said. And we completely, Sober Livers is in complete agreement with AASLD as they raise these concerns.
Is that posted up on the website?
I just put it in chat. You can actually go into chat and
okay.
click. Yeah.
Thank you.
Absolutely. Anyone else?
There's a comment in the chat saying, I wonder if messaging about this has reached high school age kids. Do you know anything about that?
What I can tell you is that certain OPOs or organ procurement organizations like here, Donate Life Colorado, we actually have educators that go into the high schools and they talk about organs and transplant. They probably touch a little bit on some of this information, but my personal answer is I don't think it's being done enough. I think we need to improve education. I think the education needs to not start in high school. I actually think it should start in middle school. We are seeing, for example, from the age group of 25 to 34, this is crazy, liver disease and cirrhosis and chronic liver disease is the 6th leading cause of death in that age group. And that's behind accidents, suicide, assault, cancer, and heart disease. Here in Colorado, it's 4th. It's the highest disease category whatsoever here in Colorado. So what that means is, because it does take some time to develop liver disease, the people that are developing liver disease in their 20s, they're drinking when they're in middle school. And so we really need to bring this message down. I think the message should start 6th, 7th grade is my personal opinion on that.
Completely agree. Any other questions? Well, if there's no other questions, thank you so much for such a wonderful presentation. We are so honored to have you here and be part of this webinar series.
Thanks, Marissa. Thank you all for coming. And if you have any questions, I had it on a slide, but please feel free to email me and I'll put this in chat, Jenn Jones at soberlivers.org.
I just want to say, Jen, that was a great presentation.
Oh, Nancy, thank you so much.
I was about to say that too.
Thanks, Nicole. These are all my wonderful advisors that are being so nice. Thank you guys. I really appreciate it. And thank you all. I'm very honored to be a part of this conversation, and I'm very eager to take this message forward and let people know, because like I mentioned, knowledge is power and we need to continue to educate. So thank you all for being here. I appreciate it. And I hope you have a great rest of your day.